Hello everyone. Welcome to the Mindfulness, Emotions, and Pain Treatment webinar. We're glad to have you here with us today. My name is Tanya Hyde and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as through donations and memberships to CIRPD. As I mentioned, my name is Tanya, and I'll be moderating the webinar and the Q&A session today. And our presenter today is Dr. Mel Pohl. Dr. Pohl is a board-certified in family practice and addiction medicine. He's the Chief Medical Officer of Las Vegas Recovery Center's Pain Recovery Program. He's the author of A Day Without Pain and his newest book with Kathy Ketchum, which is The Pain Antidote: Stop Suffering from Chronic Pain, Avoid Addiction to Painkillers, and Reclaim Your Life. Dr. Pohl, I will hand it over to you.
Thank you. Thanks, Tanya. Hello, everybody. I'm going to start with a quote. To diminish the suffering of pain, we need to make a crucial distinction between the pain of pain and the pain we create by our thoughts about the pain. Fear, anger, guilt, loneliness, and helplessness are all mental and emotional responses that can intensify pain. So what I'd like to do today, I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation. So when you present this to your clients or patients, they may not be as receptive at first as we might like. This morning, I'd like to start and describe in a bit of detail the nature of suffering, which was just what we heard in the Dalai Lama's quote. Talk about the suffering related to holding an attachment, and in the case of holding an attachment with chronic pain, we hold and get attached to the idea that we're going to be free of pain. I'll talk about mindfulness as it pertains to chronic pain. Here at the Las Vegas Recovery Center, we teach all of our clients mindfulness, and specifically those with chronic pain benefit immensely from the skill set. We probably won't be talking much about nutrition, but suffice it to say that toxic substances could cause inflammation, and inflammation increases pain. So avoiding toxins and increasing toxin-reducing anti-inflammatory substances diminishes pain. And just to mention that in addition to mindfulness practice, there are also other cognitive therapies like CBT, dialectical behavioral therapy, and ACT, acceptance commitment therapy, and physical modalities that are intervening. Those that are in line with mindfulness, of course, include yoga and Tai Chi or Qigong methodologies. When we think about pain, pain is a normal response in humans and animals to tissue, actual or potential tissue damage. With acute pain, the purposeful pain that we experience is helpful so that we don't injure ourselves more if there's already an injury, or stay away from an injury like feeling heat from a flame and avoiding it. Chronic pain is a transition from acute to chronic, and it's really a different animal. We're really talking about a response system of the human being that is lodged more in the brain than it is in the peripheral tissue. So we'll be talking a lot about brain function and where mindfulness fits in. To put pain in perspective, we need to understand that it's a multi-dimensional experience, and it's a unique experience, different in each and every person who experiences it. So, and it's impacted by culture. So there are cultures where people have a high threshold for pain. In Africa, women deliver babies with no pain experience whatsoever. And in that same culture, the men go to bed wailing and howling for 3 days. The only explanation for that is it's what's been learned and taught in that community. Context is important. So if somebody is in the midst of something functional, like I have chronic back pain, but I don't think about it or experience it very much when I'm working, even if I'm standing, which exacerbates it. But when I'm done, I usually have an ice pack around, and I'll rest and indulge the experience of pain. So contextually, what your patient is experiencing is going to impact his or her experience of pain. A huge and modifiable experience is anticipation and previous experience. Most of the people with chronic pain that I treat have a tendency to catastrophize based in rumination and helplessness and fear of the situation getting worse. And it's usually based on the fact that it's happened this way before and it's likely to continue to happen that way. We had a patient who had chronic ear pain from an unknown source. He probably had a viral otalgia that just was chronic. It was associated with tinnitus or ringing in his ears, and he had such fear and such anticipation that if the pain was at a particular level, it was going to get worse. I went in and I asked him how he was doing, and he said, "Doc, I'm doing pretty well today. The pain is a tolerable 4 out of 10, but the level is rising." And obviously implicit in a sensation that 4 is going to become 7 was strictly based on the fact that every time it was 4, it became 7. Well, I hope you can understand that the conviction that this was going to happen was a part of the experience, and that is modifiable through mindfulness and other techniques. For the gentleman I talked about, his pain was driven by emotional and cognitive factors, and each and every patient that I treat here at the center has substantial impact of their emotions like fear, anxiety, anger is extremely potent driver of pain as well, and depression. And the cognitive factors are related to distorted thinking. Really, statements like, "My pain is killing me," or "My feet are on fire," inaccurate distortions of reality, but a true belief that I am going to die from my pain experience. So part of our intervention with people is to help them see the impact of emotions on pain, and also to work with their faulty cognitions, both through CBT and through mindfulness. So I mentioned acute pain. As you can see, whether it's surgery causing or injury causing inflammation in the tissue, it's a transient activation of the peripheral nerve fibers, transient activation of the nociceptive system, functional, helpful, and the key is that acute pain resolves when the tissue damage is resolved. So I had a tooth pulled a couple of weeks ago. It's hurting less and less, and eventually I won't even remember where the site was that the tooth was pulled because it will fully heal. With chronic pain, there's a sustained current coming from peripheral nociceptors, but the nervous system responds to that recurrent chronic signal and becomes sensitized. The sustained activation causes a sensitization of the actual pain-relieving syndrome, and over time there's actually structural remodeling of the brain, so that areas of excitation like the insula and the somatosensory cortex and the prefrontal cortex are all activated and become hyperactive, so that perhaps a benign signal becomes much more significant and appears to be meaningful. And when I say that, if you think about most people with chronic pain, the signal that is generating the pain is not reflective of the tissue damage. The signal is reverberating up inside the middle part of the brain. And again, all modifiable by mindfulness practices. But the last thing about chronic pain is, or pain in general, is that nociception is perceived differently in different people. Said a different way, a particular stimulus of pain becomes a larger or smaller experience. Some people hurt more than others, said simply. And COMT, catechol-methyltransferase, is an enzyme that metabolizes a number of catecholamines, including dopamine. What we know is that there are variants of COMT where nociception is expanded and the pain experience is much higher than others. And on the converse, nociception in some people with a different variant of COMT becomes a lesser significant signal. Again, some people feel more pain than others, and we have pretty good data that says there's a genetic influence on COMT variants, and also trauma affects the experience of pain. In our center where we treat chronic pain and substance use disorder, we see about 80% of people have had significant trauma, whether it's physical, emotional, sexual, all of the above, and often people come to us with what we've coined medical trauma. People who've gone in for surgery, the surgery was successful, but the pain didn't go away. They go back for a second surgery to repair. There's nerve cutting and burning, and the net effect is they come out of the hospital after a period of time, and they have had real trauma experience, and their sensitization to the pain experience gets worse. When touched with a feeling of pain, the ordinary uninstructed person sorrows, grieves, laments, beats his breast, becomes distraught. So he feels two pains, physical and mental. Just as if they were to shoot a man with an arrow and right afterward were to shoot him with another one, so he would feel the pains of two arrows. So we're really talking about the primary insult to the tissue and then the response of the human being physically and mentally. And that was said 2,500 years ago by the Buddha, really sort of saying the same thing that the Dalai Lama said. So there's a real substantive base to say something's wrong, but the experience of what's wrong is larger than the original injury. So let me now focus on mindfulness practice. And what I think I'd like to do is take 3 minutes and actually lead people in a meditation practice. When I do this talk live, I will often ask the audience whether they think meditation is a good thing, and then 2 follow-up questions. Do you use it with your patients or clients? And usually 100% of people think it's a good thing. About half the people use it with clients in some degree or other, and the other half don't. And the third question is, do you use it for your own life enhancement? And then we're down to about a third of people. So if you're one of those people that believes it's good but doesn't practice it, often there are obstacles to practice, and some of it's the sort of mystical nature of meditation and mindfulness, which I'll hope that will be clearly dispelled in this webinar. But also, I don't have time, or I don't have the skill set, or one of the most common is I can't do it. I can't quiet my mind. That often comes up when I'm teaching this to our clients. So we're going to start, and this will be about 3 minutes, so if you can just make yourself comfortable. Perhaps close your eyes if that feels okay, if you're in a safe place to do that. And just start with the sound of this bell. Let's begin by just dropping in on the present moment as it is and holding it in awareness as best you can. Holding yourself to feel however it is that you're already feeling, whether it be pressed for time, stressed, agitated, perhaps in pain. Whatever it might be that's calling out for a bit of kind attention. And let's just bring full awareness to this constellation of feelings and circumstances, without having to do anything, without having to make anything go away, without judging it or ourselves. just put out the welcome mat for whatever is here, because it's already here. As we anchor ourselves in our breathing, holding it all in awareness, moment by moment, breath by breath, in the timelessness of right now. Now, choosing to feature one particular aspect of your experience, center stage, in the field of your awareness, as if shining a spotlight on it. It could be anything you would like to focus on. Perhaps an intense sensation in the body, or a story you are telling yourself about it at the moment. Maybe it's a recurrent thought, or a pleasant or unpleasant feeling. And simply breathing with it, whatever it is, in and out, in and out. Just holding it in awareness with great tenderness, as a mother might hold her small child in full acceptance and with great love. And simply recognizing and accepting any sensation that arises as a sensation, any thought as a thought, any emotion as an emotion. Observing and letting go of the stories behind the sensation, thought, or emotion. Now, see if you can rest in awareness itself, allowing any and all sensations, thoughts, or emotions to come and go as you dwell in the spaciousness of your own heart, allowing yourself to feel whatever it is here to be felt, and to know whatever it is here to be known. Because it is already here just as it is. Experiencing the spaciousness of awareness itself and how this awareness feels in your body and your heart in this moment. And then, as this brief meditation comes to an end, inviting yourself to bring this boundless, spacious, open-hearted awareness as best you can, even for tiny moments now and again, with the lightest of touches, to all aspects of your life as you resume the activities of your day. Now, if we were together, I would ask what that was like for you. So if you'd like to send in a comment during the question session, I'd be happy to hear it. Lama Surya Das is a Buddhist and an author, says, mindfulness lifts the fog of our ordinary lives to reveal what is hidden. It loosens the knot of self-centeredness and opens the heart. It moves us beyond mere concepts to allow for a direct experience of reality. So a few facts about mindfulness meditation. It comes from Buddhism, as you can imagine, 500 BC, but it's a non-religious form of activity. The focus with some forms of mindfulness meditation is on insight or vipassana. On others is simply being present in the moment. The goal is not to do anything. It's not to eliminate stress. It's not to eliminate pain. But often the result of meditation is less pain, less stress, less anxiety, as I'll show you in a moment. It's about using intentional, focused awareness. So it's paying attention to the present moment with intention. But the key here is without judgment. So often we have an experience and then we translate that into what it means. In the case of chronic pain, it's always a negative thought. My back is killing me, it's not fair, I'm a victim, I don't want this to be here, I want to be free of the pain, on and on and on. And all of that drives the pain levels up. What do we want? Mindfulness. When do we want it? Now. So even Buddhist monks can be impatient looking for results. So here's the definition. Willful directed attention to the present moment without judgment. It is a daily practice when, to work best, it will be done daily. And it's like tuning an instrument or exercising a muscle. They've actually shown that cells bud with mindfulness practice as little as 20 minutes. Obviously, budding cells to be sustained and for the connectivity to be enhanced, the practice needs to continue on a regular basis. The practice of mindfulness changes the brain. That's really the most important scientific fact for us to know. The practice of mindfulness changes the brain. Our brains are plastic, as I said earlier, and some of the changes are related to neuronal structures, as I said, enhancing connections, but also some are related to changes in neurotransmitter levels. So with ongoing meditation, we notice decreased cortisol and epinephrine, and also increased serotonin and GABA, which are both enhance relaxation, and serotonin, of course, is an antidepressant, the body's own antidepressant. I'd like to just go through some of the science of mindfulness practice. There's extensive research that's been done, and I'll refer you to the Journal of the American Medical Association in April of this year. There was a summary in the medical news section and a couple of articles in that edition. Churkin studied 342 adults at Group Health in Seattle, just down the road from Canada, of course. They trained in mindfulness-based stress reduction, which is a manual-based program originally created by John Kabat-Zinn, Z-I-N-N, who teaches all over the country and has trained hundreds of people to do this work. In the group that did MBSR, 43% experienced meaningful reduction in pain. This also occurred in the CBT group, and the control in that was what they called usual care, which was people who received some counseling but no formal program. That was sustained at 6 months, by the way. Monroe, in that same issue, found that with 8 weekly sessions to older adults, and this was based on MBSR, this was at University of Pittsburgh, 44% had 30% reduction in low back pain. There was 25% reduction in controls. 25% of controls had a similar response. You should know that those statistics are better than opioids for pain. Zeidan, Z-E-I-D-A-N, is published in the Journal of Neuroscience back in 2011 and then in 2016. In 2011, he noted a whole lot of information about brain scans on the modulation of pain after 4 days of mindfulness training. So it wasn't long-term training. He then exposed patients to noxious stimuli, and there was a 50% decrease in pain and unpleasantness. What he saw on brain scans was a decreased activation of the somatosensory cortex, increased activation of the anterior cingulate cortex and the anterior insula, and those two areas are responsible for cognitive regulation of the pain response. There was an activation of the orbitofrontal cortex, which was responsible for reframing the contextual evaluation of sensory events, and there was a thalamic deactivation, and that's the relay station in the midbrain that receives the signal from the peripheral nervous system. Patients said, I feel the pain, but I'm not as upset about it, and I'm able to let it go. So these are really substantive changes. And interestingly, Ziden in 2016 gave these patients naloxone or Narcan, and the effect wasn't blocked. So his hypothesis was that this relief was going through the opioid system, and in fact, it's not. It's outside of the opioid system. Just a few other facts about meditation. Meditators and people who practice yoga, according to Carlson in the journal Cancer in 2014, had shorter telomeres, had longer telomeres, and those are the genetic materials. Shorter telomeres are associated with a cancer risk. Davidson with Kabat-Zinn in 2003 taught people mindfulness-based stress reduction. They then gave them flu vaccines, and they found that the antibody levels were higher in the people that were trained in mindfulness. Better sleep time, less mind wandering, decreased inflammation in one study in 2013 after 8 weeks of mindfulness-based stress reduction. 2010, decreased pain unpleasantness. So the theme is really substantial. The changes in the brain are the most significant, and they're gray matter changes. I mean, these are really sustainable changes and with long-term beneficial effects for patients. Mindfulness is not cognitive behavioral therapy. It is a metacognitive process. So the process is to notice the thoughts, but not get engaged with them. Just notice them and return to an object of meditation, which is often the breath. So it's changing our relationship with the thoughts without doing anything about the thoughts. So if I have a distressing thought, I don't try and change it. I just notice, I'm really thinking terrible thoughts, and then I gently direct myself back to the breath. With continued redirection, we end up being able to detach from thoughts and also from feelings and physical sensations. And as I mentioned, attachment is about suffering. Suzuki Roshi said, the reason for learning meditation is not so you can sit around and meditate. It's like when you learn to drive a car in a parking lot. It's not so you can drive that car in parking lots. You learn in the parking lots because it's a restricted, safe area. When you meditate, it's like learning to drive in a parking lot. Then in time, you take the car out on the highway. Practice is cultivated in order to get around in life. We meditate in order to learn how to get to let go in our daily lives. We need to learn how to let go because trying to hold on to anything is like trying to nail Jell-O to a wall. Nothing sticks, nothing stays. And all of this is highly relevant to people with chronic pain. When we meditate, we're merely an observer or spectator of thought. So what we did in that meditation, that practice meditation, was to step back from the thought and just be present. It's helpful to start at the beginning, so anybody who sits can start as a beginner. It's called beginner's mind. It's helpful to be open-hearted and open-minded to new possibilities. And really, this is about being unconditionally gentle with yourself. So many of my patients say they can't do this and they feel like failures. So reinforcing that negative self-esteem, of course, is very unhealthy for mental growth, but also increases chronic pain. It's about tenderly holding and intimately knowing our suffering in any and all circumstances. So it's not about recoiling, but rather embracing and experiencing what's so. It does take courage. I mean, our patients sometimes are really challenged by sitting. One of the reasons is when our mind quiets, we tend to feel things, and many of us don't want to feel what we feel. Some of the realities about chronic pain are really very unpleasant. We automatically want to cover up the pain in one way or another, and we do that with thoughts and with rage sometimes, and certainly with alcohol and drugs. This is about looking directly at what's so and with compassion and humor. I'd like to describe a successful meditation. This is Jack Kornfield wrote this in one of his books. If you can sit quietly after difficult news, if in financial downturns you remain perfectly calm, if you can see your neighbors travel to fantastic places without a twinge of jealousy, if you can happily eat whatever is put on your plate and fall asleep after a day of running around without a drink or a pill, if you can always find contentment just where you are probably a dog. So what we talk about alternatively is finding meaning in the pain and using the pain as an opportunity. Sogyal Rinpoche in Tibetan Book of Living and Dying said, you may even come to feel mysteriously grateful toward your suffering because it gives you such an opportunity of working through it and transforming it. Without it, you would never have been able to discover that hidden in the nature and depths of suffering is a treasure of bliss. The technique is variable. The technique that I teach is really focusing on the breath as it goes in through the nostrils, fills the lungs with oxygen, and expands the abdomen. Thoughts come and go. They ebb and flow just like soap bubbles. And if you become aware, when you become aware, you can simply pop the soap bubble and it disappears. And the thought is gone. We cling to those thoughts with attachment as if they're real, but they are not real. Bring attention back to the breath. It's almost like training a puppy, so gently without smacking the puppy, but just reminding our consciousness that we're back to the breath. It's no effort to clear thoughts or push away the negatives or hold positive. That's really the key, is to just allow things to be as they are. Cravings and urges, which are present in pain and with addiction, are a desire for things to be different than they are. And there's no good meditation, no good outcome. Another study, after 3 months of daily meditation in 27 older adults, this came from 2008, they had less pain, improved attention, enhanced well-being, improved quality of life. Suffering that I mentioned is about holding on to thoughts or outcomes. I will be pain-free. Wanting to be pain-free, wanting to be stronger, wanting to be younger. I met with a patient yesterday who had a terrible head injury. He's got significant post-traumatic stress disorder, but he also has chronic headaches. And he was making hundreds of thousands of dollars in his former life, and he had cars and homes and relationships, and now he's reduced to dependence on disability with nothing but pain in his life. We have relentless mind activity when we experience chronic pain. I mentioned catastrophizing, ruminating, and obsessing. And these are deep-seated habitual responses to the world, so it's going to take practice to change those responses. What's really peculiar is that even though the pain is negative, attachment to it seems grounding. It's solid and familiar. I had a patient with chronic headaches who came up to me in the lunchroom and she said, "Doc, I don't have a headache today for the first time in 20 years. And I said, "What's that like?" She said, "Lonely. I don't know what to do. I'm at a loss." People are resistant to practicing mindfulness, partly because of closed-mindedness. It won't work. I don't want to do it. People say they can't sit. They're restless and impatient. And I sympathize with that. Unkind thoughts and judgments about ourselves, but also about the process. Being cynical, this isn't going to work. Prove it to me. And even after all the proof, people still are resistant. And all of these are fear-based. That fear is really the main driver of chronic pain in my patients. Many different forms of scanning the body. Body scan is one that we won't have time to practice, but it was introduced into the United States by John Kabat-Zinn. It's an old Burmese practice. And it's like scanning through the body and noticing strong sensations, much like we did in the practice meditation. And the real key is, again, observe your attitude, bearing witness to the pain, stepping back from it with awareness, and noticing that the awareness of the pain is not in pain. The part of me that's aware isn't in pain. Again, always utilizing compassion and kindness towards the self. The fear that I mentioned is if I allow myself to just give in to this pain, I will die, or I'll be unhappy and unable to escape, or I won't be able to handle it. I don't deserve to be out of pain. It won't work is a common response that I get from folks. Or if I allow the pain in, I will hurt myself. So fear is common in the experience of pain, and as a result of fear, we avoid movement. We become kinesiophobic. If, because of fear, we avoid movement, soon we can't move. So we get a shoulder that won't go beyond 90 degrees because it gets frozen. And then I can't put my shirt or jacket on without assistance. And then I feel badly about myself. I don't want to go anywhere, and the pain increases. So reducing fear is really about movement, exercise, and sort of a sense of self-efficacy that can come with mindfulness. Increasing mobility improves function, enhances self-efficacy, and decreases the pain. We are heading towards a break point, so I'll tell you that in addition to mindfulness practice, physical practices associated with mindfulness, such as yoga, where there's a coordination of the breath with the body, is really beneficial. This slide points out that research confirms that drugs give the same benefits as yoga. So this is a halasana pose. I don't know if many of you know yoga poses, but this is a back pain pose, and as you can see, on the left is the pose, and on the right is the drug effect in this poor fella with no shoes. Child's pose is one that I have trouble getting my hips down, and the fella on the right has the same sense of problem. And Savasana is total relaxation, or corpse pose, and as you can see, he's got that down pretty effectively. So I'm going to take a short break here and see if there are questions and if we can, or discussion points, and then close with some comments.
Great, thank you very much, Mel. I had a few people who did respond after the meditation practice, and yes. A few of the comments, one person said it was relaxing, one said they felt foolish, and another one said they have a group of people in the room listening to the webinar, and some people in the room were able to clear their head of thoughts and feel some benefit, and others were unable to turn off their mind. Yes,
great. So, that's a great spread of comments. I wonder if the person who felt embarrassed was in the room alone, and what might be embarrassing about sitting quietly with your eyes closed. But maybe if you were in your office and people were walking by, you were afraid they would look in. So clearly, for true meditation practice, it works best if you can carve out some time in private where you can safely sit or lie down if that feels better, and be uninterrupted. So that really means, and for me it's tough, but it means turning off my cell phone and not answering any calls. And the best time for me to do it is first thing in the morning. So I do some physical exercise, and then I sit as my practice, and I try and do at least 15 or 20 minutes per day. My practice varies. I'll mention that there are a number of websites that help us with meditation practice. One is headspace.com. Another is Breathe, BREATHE.com. And there are others that just really offer training exercises for people. And the last one is Calm, C-A-L-M. I believe it's calm.com. But you can also Google and find some apps that might work for you. For the folks that said they could not do it, I'll just remind you of the meditation instruction, which is there's no such thing as you can't do it. If you sit there and your mind is going through 100 miles an hour, thinking about what's next, I mean, typically our thoughts are focused on what's going to happen next and what's happened in the past. And for me, they bounce back and forth on an easy basis. It's just fine. If you have a busy mind that needs to think, that's what your meditation practice is for that period of time. If you are able to catch the thought, just notice it without any kind of stress, without any anxiety about it. It's not like you're doing anything wrong, but just if you're able to notice it and direct your thought back to the breath, then do it as best you can. And the process of meditation, of mindfulness, is really about doing that on a regular basis, like driving a car in a parking lot. But eventually, what we try and gain for our patients is the ability to catch those catastrophizing, negative, pessimistic thoughts that are making their pain worse. So, for example, if my thought is my back is killing me, when I notice in my meditation that I have that thought, I can chuckle at myself. Well, actually, it's not killing me because I'm still here. I'm still alive. So remember that the tendency to be critical is something that if you soften the process, you will find it more rewarding. It would be my prediction.
All right, let's see. For some questions, would you agree that if acute pain is treated effectively, it does not move forward to chronic pain?
Very, very good question. It's a bit of wishful thinking. We don't really understand why some people go on and develop chronic pain. Is it something that happened? Should we treat it with high dose opioids to suppress the pain signal? There's not really good data that says that in and of itself will diminish or prevent chronic pain from developing. There are some predictors and there are some signatures of chronic pain. One of them is smoking. People who smoke cigarettes are 20% more likely to develop chronic pain from an acute injury. People who've had trauma, whether it's associated with the acute pain phenomenon, or we often see people who had heavy trauma, adverse childhood consequences, and it shows up later in life. And I would contend that is one of the precipitators, maybe through the COMT system, that signals the development of chronic pain. Again, as I said, there are certain people that are genetically predisposed to a higher pain sensitivity, and I see a lot of patients who had sort of low-level pain syndromes throughout their entire life. I mean, we have a woman now who's got fibromyalgia, or a form of central sensitization, and she reports that she had, they labeled it growing pains when she was 7 years old. So she was almost destined to develop a chronic pain syndrome later in life, and of course she had disc disease and after a motor vehicle accident that resulted in her chronic back and neck pain. So I think we don't know, that there's no great evidence to say that if we do a good job with acute pain, it won't turn into chronic pain.
All right. Another question. How important is exercise in achieving remission when dealing with chronic pain?
Motion is lotion. So I would say in all cases of chronic pain, movement is key. Now, the relative effect and the ability of the person to function and move is going to be dependent on their condition. So, for example, there are certain people that can't move or have a limited ability to move. I'm thinking of a patient who was an athlete, and he was injured. He had a terrible wreck and chronically had a dislocation of his shoulder and had lumbar disc disease. when he came to, and he was heavily medicated with opioids, by the way. So we're an opioid-free program. When we detox people from the opioids, we find that their pain level tends to diminish. Now, this gentleman's pain went down, and what he wanted to do was resume exercise the way he had been doing when he was 20 years younger before his injury. That would, so that resumption of full activity was a bad idea, and we really had to counsel him, and he went to the gym, and he was trying to lift very heavy weights, and our physical therapist sat down with him and really explained pacing. So it's important that people don't overdo and then injure themselves or cause an exacerbation of the pain that's going to bring them away from the pain. So we'd much rather have somebody gradually increase their activity. We're strong believers in yoga and qigong, which are mindful movements, meditative practices that are associated with the breath, and it's all about working with the edge. In other words, getting to a point that is a strong sensation but not pain, and then pulling back but staying at that edge and expanding the edge. I mean, that's really how yoga works in particular. But, back to the original question and the original point, moving is critical. Increasing circulation, oxygenation, decreasing the buildup of scar tissue, and enhancing the endorphins and the quality of life neurotransmitters are all associated with activity, and we know very clearly that people who are immobilized, bedridden, have worse pain, and because of the immobilization, the tissue tightens up and it causes movement to cause more pain. So, that term move it or lose it, and we also focus with people on hurt versus harm. So it may hurt to do a particular activity, certainly limiting it and pacing yourself is appropriate, but not shutting down. And the fact is that just because it hurts doesn't reflect that the tissue is being injured worse. So I'm a big proponent of movement, and I love that euphemism, motion is lotion.
Wonderful. Another person, many of our clients use prayer. Does prayer have the same effect/benefit as meditation?
Great question. The answer is absolutely. We do sometimes have a challenge with people who have an idea of what prayer and meditation look like, and it's based in some religious underpinning. Meditation is part of our spirituality curriculum, and spirituality is a very important part, I believe, of any kind of pain recovery process. And if a person finds spirituality through prayer and religious practice, it's a wonderful way to enhance function and diminish pain. One of the challenges is so many people don't find spirituality through religion because of their childhood experiences with various religions, and religion becomes provocative, and it keeps people away from the recovery process that's based in connection and faith and sort of turning it over, lack of the need to be in control of everything. So prayer, and there's data on prayer groups. People who are prayed for have all kinds of improvements in their nervous system function and in their immune system function, and there are reports of people whose disease subsides. So where that energy works in the universe and the force, I couldn't really pin down, but I'm a strong believer, and I think there's a nice correlation between prayer and spiritual practices and meditation.
Wonderful. We also have a webinar that was done by a woman, I think about 2 years ago, that's on spirituality and chronic pain, and she studies essentially like the positive and negative effects of spirituality. And I'll include a link in the follow-up webinar, follow-up email for everyone for that as well, because she goes through a lot of the really positive effects of spirituality and then some of the mentalities that can also be negative with chronic pain. It was a really good one.
Great. Yeah, I'd be interested in seeing that. I'll just mention two other spiritual practices that we try and incorporate in our recovery process. One is forgiveness. People who hold on to anger and resentment and then the list could be very long. The person who sexually assaulted me, or my father or mother, or the doctor, or the insurance company, or the person who left the floor wet and I slipped, or the person who was driving in the other car that caused the wreck, and God, or higher power, whatever form that takes. And holding on to that, it really poisons the nervous system. So we try and steer people towards forgiving and not forgetting and not excusing the behavior, but simply not being stuck with the response. And the second is gratitude. I had a conversation with another patient who was really feeling like the victim and very spiraling down in this poor me mentality. And he said straight out, why me? Why did this happen to me? And the question that I posed back is, why not you? You do have two legs, and you do have a mind that operates. And one of the things that happens at Las Vegas Recovery Centers, people are in a milieu with other people, and there's quite a variation of level of impairment, and the stories are parallel but not exactly the same. And just being around other people who are struggling with similar problems enhances a patient's sense of well-being.
Great. Let's see. What are some signs that mindfulness meditation would be beneficial for someone? I think this is coming from someone who is a health practitioner.
I think mindfulness is appropriate for each and every patient, and I think it's an easy practice to explore. The downsides are very, very limited, and there's one exception. If somebody has a serious experience of trauma, if they're a trauma survivor and they have PTSD, we've experienced here that during the meditation practice, as the mind quiets, the trauma, the amygdala, becomes overactive, and people cannot sit, or they actually have a resurgence of their anxiety and their panic around whatever happened to them, because their defensive systems are what has been keeping them from dealing with their feelings. So I think mindfulness would ultimately be helpful to that patient, but working with him or her is going to require some special technique, and really probably cognitive therapies or dialectical behavioral therapy is going to be more in line with what's appropriate. But I can't think of any contraindication to using mindfulness. Marlatt from the Pacific Northwest brought mindfulness to prisoners and trained people in mindfulness practice while they were in prison, and had very good outcomes with addictive disorders and I believe depression.
Great. I had a question, somebody wondering about the references for literature where you stated that yoga gives the same benefit as drugs. If I follow up with you in an email, can I get those from you?
I can get you a couple of resources on yoga. That slide was tongue-in-cheek, ladies and gentlemen. That was a lead-in to the postures that the guy who was quite drunk was trying to execute. So I apologize for my irreverence here, but there are good references for yoga efficacy. So Tanya, if you remind me, I'll get them to you.
Wonderful. Let's see. And What are your thoughts on awareness, most notably around Eckhart Tolle's stance/books to date, if you're familiar with those?
You know, I know who he is. I have a couple of his books that I haven't read, so I think I would be out of line to comment on that, as if I have expertise.
Okay, wonderful. How long are the interventions you use with your patients? Are they individual or group-based? This is someone who's a mindfulness-based stress relief teacher with people with cancer.
Yeah, MBSR, or mindfulness-based stress reduction, the manual is really, you can tell me, but I believe it's 8 hours, an hour session for 8 weeks, and some of the models actually have a retreat that lasts longer. What we teach, group mindfulness, we do body scan with everybody, and that's usually about a 30-minute process. And body scan, you can find John Kabat-Zinn, Kabat-Zinn. His book is Full Catastrophe Living, and my book, The Pain Antidote, has a number of meditative practices that are listed. But I would say that, God, I lost my train of thought. Where was I going with that, Tanya? You got this.
Let's see. They were asking how long your interventions.
Oh, sorry. Yeah. So a 30-minute body scan at least once a week, although we offer it every evening. We have a CD that's in the CD player. We see a 20% pain reduction after a 30-minute meditative practice. Most of our counselors are trained in mindfulness practice, so they'll individually work with clients, and some of the DBT mindfulness practices are utilized. I start my groups with a 5 or 10-minute meditation, and then there's 2 other meditation groups where there's some education and some meditation taught. Some people resonate really well with it. Other people, as you can imagine, are quite resistant.
That's actually a good lead into the next question, which someone's wondering if you find that there's more challenge with introducing this to men, and this particular health professional says that they find it harder to get them to accept cognitive methods of pain control, and if that's something you've experienced.
Yeah, no. I mean, it's something that I think we would expect, but it is not what I personally have experienced. And I think part of it is the mindset of the treatment team here. You know, it's just an integral part of what we do. We're actually embarking on an enhancement of our mindfulness programs because we want to get them more heavily incorporated. But my personal experience is not that men are more resistant than women. I don't know that there's any data that suggests that. And again, the only thing that comes to mind is that Marlatt did it with, it was a men's prison where he brought mindfulness, and it was extremely successful. So I think part of resistance has to do with the clinician and approach. And you know, I would encourage everybody to be flexible and utilize whatever seems to meet the clients where they are. But again, I don't think there's any reason to believe that men can't embrace this in the same fashion as women.